STRENSIQ, asfotase alfa, indication and important safety information, including boxed warning. Indication. What is STRENSIQ? STRENSIQ is a prescription medicine used to treat people with perinatal, infantile, and juvenile onset hypophosphatasia, HPP. Important safety information. What is the most important information I should know about STRENSIQ? STRENSIQ may cause serious side effects, including severe allergic hypersensitivity reactions. Allergic reactions are common with STRENSIQ treatment and can be severe and life-threatening. Severe allergic reactions have happened in some people within minutes after receiving STRENSIQ and more than 1 year after starting treatment with STRENSIQ. Stop using STRENSIQ and go to the nearest hospital emergency room right away if you or your loved one get any of the following signs and symptoms of a serious allergic reaction: difficulty breathing, choking sensation, swelling of your eyes, lips, or tongue, dizziness, nausea or vomiting, fever, headache, sweating, feeling irritable, chills, skin redness, skin rash or hives, itching or numbness of the tongue, lips, cheeks, or gums.
I had begun the process of learning and trying to understand HPP because I had a name. And I began to hear about STRENSIQ through these networks. As I got the referral to the endocrinologist, he did mention, STRENSIQ. As we were talking about STRENSIQ, my endocrinologist mentioned that there are some risks, such as injection site reactions. He said, every patient's experience is different, but it would potentially help you.
The doctor explained that STRENSIQ could help improve bone health in people with HPP. They also said it might improve Quinn's mobility. It could give Quinn a better future, a different future, a future with more possibilities. And that's all any parent wants for their kid. He has experienced some side effects, like injection site reactions, but STRENSIQ is helping his hypophosphatasia symptoms.
My doctor and I discussed possible side effects. I learned about a side effect of calcifications in your eyes, and I get checked for that every year. That is not the only possible side effect of STRENSIQ, and you should talk to your doctor before you begin treatment.
Approaching the first dose of STRENSIQ, really looking for information on that, my go-to was OneSource. And OneSource has case managers who provide support and answers on treatment. They're really a solid resource for patients.
We had been preparing for the possibility of injections, so he was prepared for that from a very early age. And by the time it actually happened, he was ready to go. And he was very accepting and very brave.
At first I was a little fearful of taking injections, but I realized it may help me. It could help me do things that I wasn't able to do then that I can do now. So after I got past that, it was more easy.
I was nervous about it, but I didn't dwell on it. Knowing that STRENSIQ was something that could help with my HPP, that gave me a lot of confidence to do the injections.
I administered Quinn's injections for the first couple of years, but now that he's 11, he does his own, and he's very responsible and he is very effective. And I think that it helps him have a sense of control when he does it himself.
Actually, I had a pretty good method of practicing. I'd get my little stuffed animals. I would stick them in my little arm like I was a veterinarian and do the shot.
Doing the injections week after week has become pretty much part of my schedule. I do it before I go to bed. It's quicker than brushing my teeth, that's for sure.
I set up on the kitchen table, get all my medicine out, get my syringes out, lay them all out, and I have a very specific process for drawing the medication, preparing the injections, and then actually giving the injection.
Since I've been on STRENSIQ, I'm doing some volunteer work, and I've got my hobbies. I'm quilting and knitting, and quilting is a very physical activity. It doesn't seem like it, but it is. And so I can do a lot more things.
In certain situations, Quinn does use mobility support. It helps him go a little faster and his energy lasts a little bit longer, but over time we've seen a decreased reliance on that mobility support, and he's also gaining a lot of confidence.
I have a treatment that's really, really helping, and that's a really exciting possibility.
It's wonderful to see how happy he is and that he feels he's on an even playing field with his peers. That's important to him.
What are the other possible side effects of STRENSIQ? STRENSIQ may cause other serious side effects, including skin thickening or pits at the injection site, lipodystrophy. Lipodystrophy is common and has happened after several months in people treated with STRENSIQ. Calcium buildup in the eyes and kidneys. People with HPP are at increased risk for developing calcium buildup in the body. Calcium buildup in the eyes and kidneys has happened and is a common side effect of STRENSIQ. Calcium buildup in the eyes and kidneys may also happen in people with HPP who are not treated with STRENSIQ. Your healthcare provider should check your eyes and kidneys before and during treatment with STRENSIQ. Immune-related effects. You may develop antibodies during treatment that may decrease how well STRENSIQ works. Tell your healthcare provider right away if you get worsening symptoms of HPP, including difficulty breathing, difficulty walking, feeling tired, bone pain, stiff joints, or loss of appetite. The most common side effects of STRENSIQ include local skin injection site reactions such as skin redness, bruising, color change, pain, itching, hardening of the skin, induration, swelling, and bumps. These are not all the possible side effects of STRENSIQ. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about side effects. You will begin receiving STRENSIQ under the supervision of a healthcare provider. Tell your healthcare provider about all your medical conditions, including if you have had an allergic reaction to STRENSIQ, are pregnant or plan to become pregnant. It is not known if STRENSIQ will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if STRENSIQ passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you use STRENSIQ. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. There is a registry for people who use STRENSIQ. The purpose of this registry is to collect information about HPP and about what happens when you use STRENSIQ for a long time. For more information about this registry, talk with your healthcare provider or go to www.hppregistry.com. To report suspected side effects, contact Alexion Pharmaceuticals, Inc. at 1-844-259-6783 or FDA at 1-800-FDA-1088 or www.fda.gov/MedWatch. Please see full prescribing information and patient information for STRENSIQ, asfotase alfa, including boxed warning regarding severe allergic hypersensitivity reactions at strensiq.com.